Hi there, I'm Dr. Kristen Andrews. I'm Chubbs' mom. I'm also her veterinarian, and I'm going to take you through her dental procedure, which she had done. What my technicians are doing here is they're drawing a little bit of blood from Chubbs' jugular vein. We're going to evaluate her blood work before she goes under anesthesia. We want to make sure that there are no problems with her liver, with her kidneys, with her red blood cells, white blood cells, platelets. We want to make sure that her blood sugar level is normal, that her electrolytes are normal. We're just screening to make sure there's no underlying issues that could potentially cause a problem with her going under for anesthesia. The next thing we're doing is we're doing an ECG. This is a rhythm strip of Chubbs' heart, and we want to make sure that her heart is in good shape before we put her under anesthesia. What we're doing here is we're connecting little leads to different parts of her body. They're attached to the four legs, and again, they're little clips, so they're going to pinch just a little bit. As you saw, she did jump a little bit. We use alcohol so that the electrical conduction gets transmitted through those leads. Then we transmit that over the phone, which is really cool, and a cardiologist will read that ECG for us and send us a report within 20 minutes. And you can see the little rhythm strip on the recorder there, and that's getting transmitted directly over the phone. Next, we're going to shave Chubbs' leg and place an IV catheter. We're prepping her leg for this catheter, and this catheter is going to administer fluids during her procedure. This helps maintain her blood pressure. It helps keep her well hydrated, and it's also where we're going to administer our anesthetics through that are going to get Chubbs asleep for her dental procedure. Now, she's been pre-medicated with a tranquilizer just to make it a little bit easier for her and make her a little more calm. And here we're administering her anesthesia through that injection port. That's going to make her sleepy so that we can put a little tube into her throat, and that will allow her to inhale anesthetic, and that will keep her asleep for the entire dental. Here she's asleep enough, and we're ready to put a little tube into her windpipe. So we're going to just place that in there. And like I said, that's going to make it so she can breathe easily, and so that we can get the anesthetics directly into her lungs. That will keep her asleep during the entire procedure. Here we're just making sure that tube is in the right place, that it's far enough down, but not too far, and we're going to secure that so that it doesn't move during her dental procedure. Next, we're connecting her to the anesthetic that she's going to inhale. We're putting some lubricant in her eyes to keep them nice and moist during her procedure. And next, we're going to get her ready so that we can monitor her blood pressure during her dental procedure. We're going to use this transducer. It's going to get her pulse, and we're putting a little cuff onto her leg. And what we'll do is we'll use this little pump right here to pump that up, and then we'll release it, and we'll be able to measure Chubbs' blood pressure. We'll be monitoring Chubbs' blood pressure throughout her procedure, and it helps us determine if we need to adjust her anesthesia or adjust her fluids, and helps make the procedure safer for her. We're checking her eye reflexes, making sure she's asleep, checking her gums, making sure they're nice and pink, making sure her jaw is nice and loose, tells us that she's at a good state of anesthesia and she's ready for her dental cleaning. We'll be monitoring Chubbs' heart rate and respiration and blood pressure and her fluids and all of her vitals throughout her procedure. We want to make sure that this procedure is safe for her, that she does well, that she's pain-free. This shouldn't be a painful procedure since we're just doing a routine cleaning, but for pets that are having extractions, it can be painful. So we want to make sure that their anesthesia is at a level that keeps them very comfortable, but is safe for them. Here, Renee is using an ultrasonic cleaner, and we are removing all of the plaque and tartar from her teeth. You can see water spraying. That helps keep that little probe cool because it can get very hot otherwise. And she's moving it all over the surfaces of the teeth, removing all the plaque and tartar, which is from bacteria. That's the stuff that makes your pet's breath smell yucky. and it will discolor the teeth and can cause dental disease that can get below the gum line. So we're chipping all of that away. Chubbs didn't have a lot of tartar on her teeth. Her teeth are in good condition because I brush her teeth every day, but she still needs to have those surfaces cleaned, remove the stuff. No different than what they do at the dentist's office for us about every 6 months. Chubbs gets her teeth cleaned once to twice a year, and this allows us to get not only the outer surfaces, but we'll also do the inner surfaces of her teeth. Right now we're just working on the outsides of her teeth. We will then turn her over onto the other side so that we can get the rest of her teeth, and then we'll be able to get the inner surfaces of the left side of her mouth as well. And you can see that scaler just goes gently over the surfaces of the teeth, and that will break away all of the plaque and tartar for us. Once we're all done, we'll do a polishing, just like again they do in the dentist's office for you. And we want to polish and smooth the surface of the teeth that we've just cleaned. So we use a polisher and a special compound that we put onto there. Again, no different than what they use for you at the dentist's office. We'll do all of the surfaces of Chubbs's teeth here. And then once this is done, we'll do a little fluoride treatment for her right here. We'll just apply a little bit of this fluoride again to all the surfaces of her teeth, and then she'll be ready to go. She'll have a nice clean mouth. Her breath is going to smell wonderful, and she's going to wake up very quickly from this. We're all done. We're getting ready so that we can remove the tube from Chubbs's mouth once she's set. It's really important with our little short nose breeds. Generally, we'll leave that tube in until a pet swallows twice, but with our short nose breeds like pugs, we want to make sure that they're literally almost chewing that tube. We want them to be well awake, so we have to watch them even more closely because we don't want them to chew that tube in half, but we want them awake enough because they have very small windpipes. They have long, soft palates, which is tissue that can get in the way of their airway and make it difficult to breathe while they are waking up from anesthesia. So we want to have them a little bit more awake than most of our patients before we will remove this tube from her mouth. And you'll see here very shortly, it won't take us very long. Chubbs is going to wake up from this procedure very quickly. You can see she's starting to blink her eyes and look around just a little bit. And we're just there with her, talking to her, letting her know she's okay. She's getting ready there. She's just starting to move her tongue a little bit. Keeping an eye on that tube, and there she goes. She's about ready to go. She's starting to chew on that. Like I said, we don't want her to chew that tube in half, so at this point we're going to remove that from her. And there she goes. She's ready to sit up and looking around, and she's ready to go. We've gone ahead and removed Chubbs's IV already. She likes to go in circles when she's in her cage as she's recovering, and she tends to get tangled up. So we've removed that early. But generally, our patients will have that IV in their leg until they go home in the afternoon. Chubbs will be here to recover in her cage until we go home this afternoon. And as you can see here, this is just a couple hours after she was done with her dental. She's feeling much better, much friskier, and acting more like her normal self. Finally, Chubbs is home. She's feeling a whole lot better. She's ready for some snackies. I hope this has helped you understand what happens when your pet goes under for a dental. I hope it's made it seem not so scary, and I hope you'll understand the importance of doing so. Thank you for watching.